The late afternoon sun slanted across my mahogany desk in a long, golden spear, illuminating the tiny dust motes that danced in the quiet air of my consultation room. There is a specific kind of stillness that settles in this space when a patient is standing on the precipice of a secret they have guarded for many years. Across from me sat Eleanor, a woman of 68 who carried herself with the upright, unyielding dignity of the history professor she had once been. She had spent a lifetime documenting the rise and fall of great empires and the shifting of ancient borders. But today her focus was narrowed down to the porcelain tea set on the side table, and her usual composure felt as brittle as sun-bleached parchment. She spoke in a voice that was barely a whisper, a stark contrast to the authoritative tone that must have once filled lecture halls, telling me that she felt as though she were becoming a desert. It wasn't just her skin, she explained, but something deeper, something internal that felt as though it were being slowly erased by time. It had reached a point where even a brisk walk to the library created a persistent burning sensation, and the thought of intimacy had become a source of genuine dread, like trying to run a marathon on a broken ankle. Her previous doctor had brushed her concerns aside with a wave of his hand, telling her it was simply part of the territory at her age and that she should buy a tube of cream and learn to accept the decline. But Eleanor was not ready to be a relic, and she asked me with a heartbreaking sincerity if the soil was simply too parched to ever bloom again. I looked at Eleanor and saw not a relic, but a woman experiencing a very real and profoundly treatable clinical condition known as genitourinary syndrome of menopause. I told her that her previous doctor was wrong and that she wasn't a desert at all, but rather a garden that had been denied its necessary irrigation. While hormones and medical creams have their place in our toolkit, I explained that there was a powerful clinical intervention she could perform herself in the total privacy of her own home. We began to talk about what I call the river of life, which is the physiological process of vasocongestion, and how frequent, intentional self-pleasure can actually remodel, revitalize, and essentially reverse the structural changes that we call atrophy. To understand how we could begin the process of reversal, we had to first look at what was happening to her body under a microscope, because our tissues are never truly static, but are in a constant state of turnover. In a woman's younger years, the vaginal walls are thick, supple, and rich in rugae, which are those beautiful, accordion-like folds that allow the tissue to stretch and expand without trauma. These walls are fueled by estrogen, which acts as a master signaling molecule to keep the cells plump and saturated with glycogen. As we move into the decades of the 60s and 70s, the lack of systemic estrogen causes several structural changes. The top layer of the vaginal wall, the epithelium, begins to thin dramatically, often dropping from 30 cell layers deep to a mere 3 or 5, making the tissue as fragile as wet tissue paper. Those vital accordion folds flatten out, and the tissue loses its give, leading to the tightness and narrowing that Eleanor found so painful. Furthermore, without glycogen, the good bacteria known as lactobacillus disappear, and the environment becomes more alkaline, which invites chronic inflammation and stinging. Because the tissue isn't being asked to perform, the body eventually prunes away the tiny capillaries that feed the area, leaving the tissue pale and poorly oxygenated. I told Eleanor that her tissue had essentially gone into a state of hibernation because there was no blood flow calling to the cells, and so they had stopped producing the collagen and elastin needed to keep her comfortable. Our mission was to wake them up and call the blood back to the surface. This is where the magic of clinical biology meets the power of the individual intent. When a woman engages in the techniques of the second spring, specifically the slow, deliberate, and rhythmic buildup of arousal, she triggers the process of vasocongestion. During arousal, the brain sends a signal to the pelvic region to open the gates, a process mediated by the release of nitric oxide, which acts as a powerful vasodilator. Blood rushes into the clitoral bulbs, the labia, and the vaginal sponge, causing the tissues to physically expand. This expansion is the first mechanical step in restoring the rugae. As the blood pressure increases in the pelvic capillaries, a clear, nutrient-rich fluid called transudate is pushed through the thin vaginal walls, acting as the body's own internal lubricant. Every time a woman achieves this state of arousal, she is irrigating the desert and forcing oxygen-rich blood into tissues that have been starved. This oxygen is the primary fuel for cellular remodeling. Going deeper, past the surface and into the connective tissue beneath the skin, we find the architects of this restoration, the fibroblasts. These cells are mechanically sensitive, meaning they are like construction workers who only show up to the job site when they feel the tension of a stretch or the hammer of movement. When a woman engages in manual stimulation and internal pressure, she is providing that mechanical stimulus. These stimulated fibroblasts begin to weave new collagen fibers and repair the elastin network, producing molecules that hold onto water and give the tissue its bounce. Over 3 to 6 months of consistent, twice-weekly practice, this process actually thickens the vaginal walls. It is not just a temporary flush of blood, but a structural rebuilding of the foundation. I explained to Eleanor that she wasn't just seeking a moment of joy, but supervising a multi-month architectural restoration project of her own body. In the world of sexual medicine, we have a saying that we must use it or lose it, and if we have lost it, we must use it to get it back. Comparing the states of the tissue is like looking at a dried-up riverbed versus a lush valley. In the atrophic state, the tissue is paper-thin and pale, prone to tearing and stinging because the pH balance has shifted toward the alkaline. But in the revitalized state, the tissue becomes pink, rich with oxygen and supple once more. Clinical studies have consistently shown that women who maintain a regular frequency of sexual activity, whether solo or with a partner, have significantly higher tissue health scores because the mechanical action and vascular response act as a biological clock reset for the local environment. I proposed a 4-week roadmap to Eleanor, emphasizing that we would treat this as physical therapy rather than a race. In the first 10 days, the focus was purely on hydration and repairing the surface barrier. I advised her to apply a high-quality hyaluronic acid serum designed for vulvar use every night to help plump the interstitial tissues. During this time, she was to spend 10 minutes in non-genital arousal, massaging her neck, her breasts, and her abdomen with a warm, natural oil to start the dopamine build without stressing the fragile local tissues. She was inviting blood to the general pelvic area first, like warming up an engine before a long drive. In the second 10 days, the goal shifted to gentle awakening. Using a generous amount of a silicone-based lubricant for its superior cushion, she was to use the flat pad of her finger to gently stimulate the clitoral hood, staying entirely external. The medical intent here was to initiate microvasocongestion and ask the blood to enter the clitoral bulbs. I told her to feel for the warmth or a slight heaviness, which is the signal that oxygen-rich blood is arriving to start the repair work. By the 3rd week, we moved into what I call the lighthouse expansion. While continuing the external work, she was to add a single, well-lubricated finger at the opening once arousal was present. Utilizing the lighthouse principle, she would apply a slow, steady, and unwavering pressure against the side wall of the opening without moving in and out. This provides the fibroblasts with the mechanical signal they need to start producing collagen, stretching the tissue from the inside out and gently waking up those dormant rugae. In the final week and beyond, the goal became full irrigation. Once or twice a week, she was to follow the buildup until she reached a full release. The involuntary, rhythmic contractions of an orgasm act as a vascular pump, clearing out metabolic waste and sealing the new oxygen and nutrients into the cells. One of the most surprising clinical results of this frequent self-pleasure is the restoration of the vaginal pH. As the walls thicken and blood flow returns, the cells once again begin to store glycogen. This glycogen is the primary food source for the good lactobacillus bacteria. As they return to feed, they convert that glycogen into lactic acid, moving the environment from alkaline back to its healthy acidic state of approximately 4.5. This natural acidity is the body's chemical shield, stopping the burning sensation and preventing the chronic infections that so often plague mature women. Eleanor returned to my office 3 months later, and the change was remarkable. The brittleness in her voice had vanished, and she sat with her legs crossed comfortably, a vibrant silk scarf around her neck, and an open, relaxed posture. She told me with a twinkle in her eye that the desert was gone. It had taken time, and there were days in the second week where she thought it wouldn't work, where she felt that old familiar sting, but she had stayed with the plan. The burning was gone, and the tightness had transformed into a suppleness she hadn't felt in a decade. Most importantly, she said she no longer felt like a history project, but like a woman whose story was still being written. Her success was a direct result of consistent vascular loading. By taking control of her intimate wellness, she had forced the regrowth of capillaries, rethickened her epithelium, and restored her acid mantle. This practice should continue even after the atrophy is reversed because, like any physical therapy, consistency is the maintenance dose for pelvic health. Furthermore, the afterglow hormones like oxytocin and prolactin keep the brain's pleasure centers active, providing a major defense against emotional flattening. The nitric oxide released improves systemic cardiovascular health and skin tone. As a woman in her second spring, Eleanor learned that she was not a desert to be accepted with resignation, but a regenerative miracle. Every woman has the power to remodel her own body and reclaim her comfort. Your pleasure is not just an indulgence, it is your medicine. It is the river that brings the water, the workers that rebuild the walls, and the fuel that restores the shield. You are the master architect of your own bloom, and your best years are defined by your own vitality. It is vital to remember that this information is for educational and informational purposes only, and is not intended as medical advice or a substitute for professional consultation. No doctor-patient relationship is established here, and you should always seek the counsel of your own physician regarding your unique medical history. Severe atrophy may require a multimodal approach involving hormones or other prescribed therapies, and if you experience bleeding or severe pain, a physical examination is mandatory. Never disregard professional medical advice because of what you have learned here. Individual responses vary, and any use of these techniques is at your own risk. Always resolve any active infections before beginning mechanical stimulation, and remember that reliance on this information is strictly at your own discretion and responsibility. Would you like me to go deeper into the specific chemistry of lubricants, or perhaps discuss how to share this new vitality with a partner?